When times are tough, companies must innovate. Technology, not just a luxury, an actual survival tool. Some of American businesses' household names like Motorola, Hewlett-Packard, Ryder, Texas Instruments, and even Interstate Bakeries. If you don't know that name, you do know Wonder Bread. All those companies were founded during the Great Depression, and they all have something in common. They were built on the need to innovate, to make people want to buy what you have, new products or new ways of doing business. And since we're in a great recession, we have set out to look for the next generation of innovators, companies that are using technology to gain an edge in this tough world, an edge that we're calling the tech effect. We're going to have it 2 times a week. It premieres today, and Jim Goldman is our lead. Jim.
Aaron, good afternoon to you. Look no further than the trillion-dollar healthcare industry mired in technologies pioneered, some of them 50 years ago. Huge opportunities, enormous money for big and small companies alike. Enter tiny InTouch Health and its tech effect on doctors.
So here we are.
When Dr. James Good makes his rounds each morning at 4 different rural hospitals hundreds of miles away from each other.
Good morning, ma'am. Dr. Good.
He never leaves his desk.
Hello, everybody.
Dr. Good is one of the first doctors to drive these robots into the ICU to visit his patients virtually.
Are you up for rehabilitation?
His patients see him live on the screen, and he sees them through the robot's camera, technology from InTouch Health in Santa Barbara, California.
We can actually beam someone to another location as a robot and allow them to take care of the patient.
How are you feeling?
Specialists from other hospitals and from other states can log on to the robot through the internet to offer their expertise, providing a level of care that otherwise would be out of reach for small community hospitals.
The robot can see very nicely. It can listen. We have a stethoscope on it. The robot is a medium for me, wherever I am, to see a patient wherever that patient is.
And the robots make good business sense, too. Already used in 200 hospitals, each spending $6,000 a month to lease them, including Palm Drive Hospital in rural Sebastopol, California, which says the technology saved the facility from shutting down.
Last year, we lost $2 million. This year, we're going to make about $500,000. So the robot has had a tremendous impact.
Because Palm Drive Hospital can now keep its patients instead of transferring them.
Well, I'm all done with the round, so I'm going to go back in my closet.
A high-tech prescription for top-notch care and a better bottom line for the hospital. Yeah, computers, networking, the internet, lots of technologies at work there. Dr. Good is working with those 4 hospitals, as you saw, and next month plans to share his expertise with a hospital in a small town in Arizona. The tech effect at work. Aaron, back to you.